So I wanted to talk just a little bit today about what is a facial plastic surgeon. So I often have patients that will come in to see one of my partners and say, oh, I didn't realize that you're a plastic surgeon. And so, there are typically what we consider are the core four in aesthetic or cosmetic type surgery. So you could have done, like myself, a internship in general surgery. You then did a residency in head and neck surgery or ear, nose, and throat or otolaryngology. So that's typically 1 year and then 4 more years, so 5 years of training, and then typically you do a fellowship after that. So whereas about 25% of our head and neck board exam is facial plastic surgery, you then go do a dedicated head and neck facial plastic surgery fellowship. So you're just doing cosmetic or reconstructive surgery on the face during that time. You have mentors that are boarded by the American Board of Facial Plastic and Reconstructive Surgery, and so you're getting great training. You're learning just about operations on the face, so you're not doing anything on the body. But there are essentially 3 other groups of people that you can get cosmetic or aesthetic treatments from. One group is dermatologists. Okay, so you can go. Typically, you do a internal medicine year, 1 year, then you do 3 years of dermatology residency, and then many of them will do even a dermatologic surgery or aesthetics or injection fellowship. They're often very, very good with lasers and non-surgical types of injections, Botox, fillers, things like that. They'll often do skin cancer reconstruction themselves. So that's a second of the core 4. So you got facial plastics and you have dermatology. You also have general plastics. These guys have probably maybe the best PR guys of anybody. So they've gone and done a general surgery residency. So they did gallbladders, appendixes, colon surgery, hernias, things like that. And then they go and do a general plastics fellowship after that. And so typically these guys are doing very often face stuff, but often will do other things such as breast reconstruction and breast enhancement, tummy tucks, liposuction, Brazilian butt lifts, things like that. They're doing plastic surgery all over the body, including the face, and some of them are very, very good on the face. And then the fourth group is oculoplastic surgery. So these are folks that have done usually a transition year or internal medicine first year. Then they go on and do 3 more years of ophthalmology. So they do operations around and of the actual eyeball itself. And then they go on and do an oculoplastics fellowship. So again, they're working on reconstructive and cosmetic surgery. Typically, they're very, very skilled around the eye. And so those are basically the 4 types of doctors that most commonly we would say are going to be very skilled and safe to go have aesthetic or cosmetic treatments from. So again, it's oculoplastics, general plastics, facial plastics, and dermatology. So those are what we consider the core 4. That's a little bit about what a facial plastic surgeon is. So if you have any questions, please let us know. Thanks.